Just one pill a day can double or even triple your testosterone levels. In this video, I'll discuss a sensitive topic that's often taboo online and in clinics: testosterone in men. Without injections, gels, or implants, and with minimal side effects, it's often possible to boost testosterone and improve quality of life. When discussing testosterone increase in men, the first thing to clarify is the need for a proper diagnosis. Low testosterone or hypogonadism, medical jargon for testicles not producing enough testosterone, needs to be diagnosed. The first step is to determine the cause and make a diagnosis. For this, we look at symptoms like low libido and often erectile dysfunction, fatigue, muscle mass loss, strength decrease, irritability, mood swings, sleep pattern changes. You had a normal sleep routine, but now it's different, worsening. You haven't changed your daily habits, also reduced physical fitness. Exercises you could do are now harder. You feel you're getting worse. Infertility can also signal hormonal issues affecting testosterone, sperm production, and fertility. Decreased concentration and focus are common symptoms in patients with low testosterone, known as hypogonadism. Along with these symptoms, we need to conduct laboratory tests. As a specialist in hormonal changes, I've seen this many times. As a doctor specializing in testosterone, many patients seek me out, partly because I'm a man who understands both the medical and patient perspectives. For years, most of my consultations were about testosterone. Patients relate to a young male doctor who's an expert in these hormones. I've gained extensive experience in this field. So what's the issue? Often patients get testosterone replacement without proper lab diagnosis based only on symptoms. That's a big mistake. We need to combine symptoms with laboratory test results. Not just total and free testosterone, but also two key tests: FSH, follicle stimulating hormone, and LH, luteinizing hormone. Why is confirming the diagnosis so crucial? It should be done twice, as hormone levels can fluctuate at times. Testosterone levels drop slightly, but the testicles eventually recover their function. It's crucial to note this. And two tests are needed to rule out lab errors. Why is this important? We need a diagnosis to determine if it's central or testicular, as this affects treatment. How does testosterone production work? It's essential that you understand this. The hypothalamus produces GnRH, stimulating the pituitary to release two hormones: luteinizing hormone, LH, and follicle stimulating hormone, FSH, which increases sperm production and induces this production in the testicles. LH also increases testosterone production. So you have this stimulation cycle. When enough testosterone and sperm are produced, the body signals to stop. This is called negative feedback. This signal reduces LH and FSH production, lowering testicular stimulation. Levels drop slightly, triggering more hormone production, which then increases. Our body keeps regulating itself, constantly adjusting. When levels are low, more stimulating hormones are made. When optimal or high, less stimulation occurs. So this diagnosis is crucial. Why? If it's a testicular issue, if you have this signal to produce but can't make testosterone or sperm production due to testicular issues or genetic alterations, for example, or because the patient had a condition where the testicles are no longer producing, or are no longer able to produce testosterone, this pill won't be effective. So it's crucial for us to have this diagnosis. If it's a testicular cause, there's no clear indication, so it won't raise testosterone levels. In this case, hormone replacement with testosterone is the best approach if levels are truly low. Why? The testicles won't be able to produce it. Now, when we have what we call hypogonadotropic hypogonadism, that's where this pill can be effective and have a good response, even increasing testosterone levels significantly, doubling or tripling them. Why? The testicle is capable, it just lacks the stimulus to produce, so it ends up increasing. What's the difference? When I talk about this medication, I'm referring to clomiphene citrate, a selective estrogen receptor modulator. This video is a bit more technical than usual. As you know, I don't typically make videos like this, but some topics require a more detailed explanation. So, What does this medication do? Simply put, it targets the hypothalamus, binding to estrogen receptors as an antagonist without function, tricking the hypothalamus and pituitary into not detecting that testosterone is at ideal levels when it's actually not. This causes continued stimulation of the testicles, resulting in higher testosterone levels. However, the testicles must be capable of producing testosterone for this to work. How does this pill differ from testosterone replacement therapy? There's a significant difference. Why? When I prescribe testosterone, I assume the patient can't produce it naturally. Higher testosterone levels can inhibit the hormonal axis, potentially causing testicular atrophy. This often happens to people using anabolic steroids like testosterone. The body, pituitary, and hypothalamus detect this and inhibit natural production. There's enough testosterone so the testicles don't need to produce more. This can lead to several issues, including infertility. It blocks this hormonal axis. So, before testosterone therapy, we must check if it's truly a testicular issue. If you stop using testosterone, levels will drop even further, reducing until your hypothalamic pituitary testicular axis recovers. What happens when you use clomiphene citrate? The body stimulates production, and the testicles themselves produce testosterone. Many videos claim this is a natural way to boost testosterone, which is false. It's a chemical solution, a drug, but your body produces the testosterone naturally, so it's not a natural solution, but your testicles produce it. In this case, when the medication is stopped, when the patient discontinues use, testosterone levels, which were higher, return to normal, often slightly above, which is an interesting feature, as the testicles may increase in size and experience improved function to some degree. So this is one of the big differences. And when we have confirmation, before you replace or use this medication, it's crucial to ask your doctor, what's the cause? Why is this happening? You need to know this. I always try to find the cause, not just the diagnosis, but also why. Often, low testosterone can be reversed when a patient returns to ideal weight, as obesity can cause hypogonadism, which affects testosterone levels. Fat tissue or adipose tissue has the role of converting testosterone to estrogen, which can worsen hormone production. High stress, changes in sleep patterns, or an irregular routine can also affect it. So there are many important causes that your doctor should identify and you should know. Sometimes the doctor knows but doesn't say, and then you can't solve the whole issue. Now let's discuss dosage and side effects. What are the contraindications? Generally, clomiphene citrate is well tolerated, with few contraindications. One contraindication is when a patient has a hormone-sensitive tumor. It's crucial to investigate this as well. Liver issues and allergies to the substance are also problematic. Another contraindication is when the testicles aren't ready to produce testosterone. Why is it contraindicated? Once, a patient told me I had no reason to prescribe this medication. He said, "At least it won't do any harm." That's just sweeping dirt under the rug, as they say, but it can be harmful, when in reality that's not the case. When you take this pill without proper testicular function, you risk side effects without benefits. So you need to be very careful with the prescription too. When I make these videos about medications, I don't want anyone self-medicating, as it can be very dangerous, okay? Promise you won't take pills thinking they'll boost testosterone, as it could be risky. What are these changes and possible side effects? Remember, this drug is usually well tolerated. Side effects, if properly prescribed, occur in less than 10% of cases. One effect that often prevents use is mostly temporary. Visual changes. It's visual blurring or decreased vision. It's significant. So I always tell patients to watch out for it. We often change the treatment approach because of this. Headaches, mood changes, and acne can occur as testosterone increases. Gastrointestinal effects like nausea and vomiting can happen. Few patients report diarrhea. It's rare, as I said, less than 10%. These gut symptoms are under 5% of cases. Another reported effect is gynecomastia. Clomiphene citrate can increase estrogen, known as the female hormone. We know men have some estrogen. When it increases slightly, this effect is reported. Many doctors wonder if this pill raises thrombosis risk, an initial hypothesis we had. How can it increase estrogen in some cases? Could it also increase thrombosis risk? We know estrogen relates to thrombosis, but the answer is no. Studies haven't shown this, at least in available clinical trials so far, so it has this safety profile. Vasomotor effects, which we often call redness or facial flushing, are generally well tolerated. With proper guidance and monitoring, we can minimize these side effects if the patient is among the minority who might experience some changes. Now, what about the dosage? Is this treatment FDA approved? Why might it sometimes be ineffective? What are the possible reasons? It's important to note that using this medication for men is not FDA approved. This is what we call off-label use. As it's been used for decades, there are studies supporting its safety and the data I'm sharing with you here. However, this drug was initially created and approved for use in women's fertility. It's crucial to understand this, because often patients don't realize you read the label after consulting your doctor and it said it was a medication only for women. While that's the official indication, clomiphene is also important for use in men. What's the dosage? It varies by individual, but low doses often work if the testicles function well. What are low doses? 12.5 milligrams daily. If splitting pills is hard, you can take 25 milligrams every other day. Why do I say low doses usually work? We get better results with fewer side effects, and it's crucial because forums discuss clomiphene, and you might find info from non-specialists or friends, which is why I emphasize this point. I think it's crucial to consult with a doctor. I've seen many patients using extremely high doses of clomiphene. Not only does this lack benefits, but it also increases side effects. Often, I've had patients come in with various effects, hormonal axis changes, and increased estrogen. When I talked to one, he was taking 100 milligrams of clomiphene, which is a really high dose, okay? For men, we usually prefer lower doses. The doctor should assess based on tests and clinical factors, as the dose can vary. There are few studies on the long-term safety of clomiphene use, all right? Continuous use for 20 years, like hormone replacement therapy, it's crucial for the doctor to reassess if the medication is still needed at each visit. High doses can cause side effects and lead to what we call tachyphylaxis. The receptor changes, and the patient starts developing tolerance to the drug. So you'll have side effects and tolerance without the desired effect. Got it? And why might this medication not work? Why do some respond so well and see such significant improvements? They improve, double, even triple the count for testosterone. And why doesn't it work for others? The first thing is about the indication I mentioned. Sometimes the indication is incorrect. Even with the right indication, a patient may have erectile dysfunction or fatigue or other changes I mentioned, not directly linked to testosterone levels. So the patient has an issue causing erectile dysfunction, as most causes aren't testosterone related. I don't know if you knew that. It's not an organic cause from the body or testicles, for example. It could be emotional or another non-hormonal disorder. In these cases, altering testosterone won't help, as the cause is different, not organic or testicular. So this is another group where the medication won't have the expected effect. And in the other group, there's a unique aspect. Some patients convert more clomiphene to zuclomiphene, not enclomiphene, which would have more benefits. Another group lacks estrogen, as clomiphene binds to receptors. So many patients' symptoms don't improve. So there are various factors at play. You see, it's not simple to just take pills based on videos or friends' advice. It could harm your health. This topic is also frequently discussed. Can I take clomiphene before sex to boost potency, even combined with tadalafil or sildenafil? Tadalafil is Cialis and sildenafil is Viagra. I'm not sure how you know this, but many ask about it. The answer is it doesn't make sense, because clomiphene citrate, it has a whole process. Generally, this process takes weeks. So it's not like those meds you take an hour before sex, for example. It's quite different. So it doesn't make any sense. You might even have side effects without any benefits, because that's not how it's used. Like this drug, if misused, many vitamins and supplements can also be harmful. Some supplements can even be dangerous. You get no benefit and still risk your health. I've made a video about supplements that are useless and potentially dangerous. Want to know which supplements? Then I suggest watching that video. I'm sure it'll be helpful and you'll learn. If you have questions, write in the comments. I always enjoy reading and replying. Also, mention the city you're from. I'm from Porto Alegre. Take care. See you next time.